Hey guys, so if you're watching this video, chances are you're interested in Graston Technique, myofascial release, some sort of active release, or soft tissue based mobilization. So I've been doing Graston for about 12 plus years at the time of this recording. So I wanted to talk to you about the biggest myth and common misconception. A lot of people hear about Graston, a lot of people come to me as a result of my myofascial work and things that I do within my office. That being said, guys, the biggest myth is that Graston has to hurt. A lot of people think that, quote, scraping the tissues as hard as you can to initiate that red response is a good thing. Sometimes you're bruising tissues, sometimes you're hurting people. I even had a recent patient who could not get Graston for a little while because somebody who did Graston on them literally opened up a scar or opened up a wound, and it scarred over and it got infected. And then they had to go through antibiotic treatment, and it was a big mess. So the biggest complaint or biggest concern that maybe you out there has is that maybe this is too aggressive for you. The truth is that Graston should not be aggressive. It should not be over the top, and anything that is, quote, on the extreme of one side or completely over the top is probably outside of the range that you would like to do. I really wouldn't recommend that either, because there's a certain pathophysiology that occurs once you hit like a 7 out of 10 in terms of pain scale. When you're talking about treatment using the Graston tools to scrape or to initiate healing, that's exactly what we're trying to do. We're trying to heal and make it therapeutic. If somebody's digging in you as hard as they can with a tool, with their hand, with an elbow, and they're making you sweat, you're increasing your heart rate, you're increasing your blood pressure, you're increasing your respiratory rate or respiration rate, you're sweating. These are all signs of sympathetic dominant behavior, fight or fight behavior, right? And fight or fight, we know for a fact, is overstimulation to the nervous system and to the body. And if we're overstimulating your body in a negative way, we're doing the quite exact opposite of a therapeutic relationship. So to answer the question bluntly, does it have to hurt to do Graston? Then the answer is no. It should not hurt to do Graston or scraping technique. It may have some areas of discomfort or tenderness, but you should be working with your provider and having a constant open dialogue and communication to allow the reduction of pain overall. You shouldn't be going to somebody to increase their pain so that you feel better, so that they're torturing you throughout. It should be therapeutic. You should feel better during the treatment, maybe areas of uncomfortable, but at the same time, it should not be overly dominant in terms of pain. So this is the biggest myth and the biggest question I get regarding Graston right now is, does it hurt? So I don't think it should. If it's done properly, it should be not only not painful, but it should be very therapeutic.